Welcome back. You're watching Bottom Line. Shifting focus to the COVID situation now. Amid another sudden surge in cases across the nation, an incident in Manipur has grabbed attention. Well, a 48-year-old Anganwadi worker in the state died a week after receiving her first dose of the COVID-19 vaccine. The health worker, a resident of the state's Bishnupur district, had received her first shot of vaccine on February 12th. She was reportedly taken to the Moirang Community Health Center on February 18th as she was facing breathing problems and subsequently passed away at the health center the next day. It is yet to be ascertained, however, as to what exactly led to the death. At a time when, despite the rapid vaccination rate in the country, there is a visible reluctance on the part of many to take the vaccine, can incidents like these trigger more confusion? Well, to discuss this and much more, I am being joined by Dr. Rakesh Periwal, Critical Care Consultant, Apollo Hospitals, Guwahati. Welcome, Dr. Periwal, to Bottom Line. Dr. Kishore Kumar Barman, Deputy Medical Superintendent of Nemcare Hospital and Nodal Officer for COVID-19, also joins me from Guwahati. And from Manipur, I have Dr. Shyam Sundar, Director, Family and Health Welfare, Manipur. Thank you so much, all of you gentlemen, for joining me on Bottom Line. If I can go to Dr. Shyam Sundar first. Dr. Shyam Sundar, of course, very unfortunate incident there in the state. An Anganwadi worker passing away a week after taking the COVID vaccine. Any updates on what could have been the possible reasons for the demise? Of course, the post-mortem is being performed. Any updates so far, sir?
Nabarun ji, the report on post-mortem is being awaited. Is going to take not less than 20 days time for the reports to come in. Histopathological examination reports on the one hand, and then chemical analysis of the visceral contents. They are going to take any time between 2 to 3 weeks time. Until then, we cannot exactly pinpoint the accusing finger towards the vaccine as the causative reason behind the death of the woman. However, the fact remains that the woman was hale and hearty before she was given the vaccination, and the symptoms started developing on the 16th, because of which she was taken to the nearest health facility, where the case was diagnosed as a case of simple allergy, and doctors perhaps were under the impression that it was a simple case of allergy and then it had nothing to do with vaccine, and therefore she was sent home after simple medication. However, the problem did not subside apparently. The next day she was brought again, and again the condition was not seen as a very, not severe as such, but potentially the vaccine could have been one of the triggering factors, and the patient was again sent home. Perhaps if the patient was kept under observation for another 4 or 5 hours, or maybe perhaps for 24 hours, I believe that things could have been averted.
Okay. That's a very important observation. Dr. Periwal, well, health workers, doctors have already been vaccinated. You have been vaccinated. But despite this, there has been concern and also reluctance on the part of many when it comes to taking the vaccine. An incident like this, though, let me make it very clear, we are still awaiting the reports of what could have exactly led to the demise. But still, incidents like these create a lot of sensation and maybe also create a lot of apprehension. And maybe calls for increased awareness on the vaccine, on the vaccination process. Even though we have, India has successfully vaccinated close to 1 crore population so far, probably one of the fastest rates in the world. Despite this, the apprehension does remain, isn't it?
Yeah, and that's fairly human, because that single news creates a lot of apprehensions. But if you look at the numbers, 1 crore vaccinates, you may not have this number anywhere for any vaccine for an adult. This is the first time we are trying to vaccinate the entire population. And adverse events, they are foreign proteins. Obviously, you can have an adverse reaction to a food and die, that does not go reported. It's the same with the vaccine. It's a new kind of protein which is being introduced in your body. Yeah, some people may have some form of adverse events. It is important to report them at time, to take care of them. I don't shy away from saying that the vaccines will be 100% safe, but we are very close to that. If you look at the number of adverse events which have been related to vaccine, they have been very few. And then we do mass vaccination, we look at the benefit versus the adverse event, and I think the benefit outweighs immensely. So, I think this should not dissuade any one of us. Let us look at from the scientific statistical perspective. These vaccines have been tried, tested. The entire idea of vaccination is not very new, and then we are looking at beating a disease which is a pandemic. Some stray incidents here and there, yes, maybe, but that should not dissuade anybody.
Dr. Kishore Burman, we also have had reports coming in from some of the northeast states where even frontline workers, health workers were reluctant to take the vaccine in the initial stages. Did we face any such kind of situation in Assam, or it was far more smooth given the way Assam has handled the pandemic from the right from the very beginning?
Good evening. Initially, we also faced some reluctance for taking the vaccine, but as soon as we started taking the vaccines ourselves and the doctors, then rest of the staffs and healthcare workers also started to take their vaccines. Fortunately, in our hospital, we have vaccinated approximately 1,100 persons, but there was no severe reaction in our hospital. Already 21 days has passed from the first day we started vaccination. Till now, no adverse effect reacted in our hospital.
Dr. Periwal, same would be the case with Apollo hospitals, I guess.
True.
Hundreds of health workers must have been vaccinated.
Yeah.
And all doing good.
All doing good, yeah.
Absolutely. Dr. Shamsundar, again, even in Manipur, in certain districts, especially in hill districts, we have had reports coming in where even health workers were little reluctant to take the vaccine in the first phase. Do you think the challenge still remains with the state health department to drive home the point that things are very safe?
Nabarun, yeah, it is true. There is some amount of apprehension on the minds of the people, on the minds of the health workers. However, the vaccine is very safe. The sheer number of people vaccinated so far has proved that the vaccine is really safe. And then if we take care, especially in cases where these mild symptoms of AEFI do happen, there is nothing to worry about it. However, since this is a voluntary exercise, people still have, some of us still cannot dispel the doubt from their minds that the vaccine may have some effect on their system. And then, in fact, it varies from individual to individual. And then some of the health workers, they still find it a little apprehensive to take the vaccine. However, the percentage that we have achieved so far with the first dose has come up quite reasonably well. We have touched, as of today, 63%. The target set for these healthcare workers in the entire state was 46,729, of whom we have vaccinated 29,616. This is the latest report which has come in, and the percentage now stands at 63% of all healthcare workers. And this stray incident of course, losing someone's life, yes, it has an impact on the minds of the people, but then this is not going to be a deterrent for further vaccination. And I believe that in the near future, the percentage of this healthcare worker vaccination will come up, and then I believe that almost the entire target will be achieved. The only thing is that it is taking a little longer than our anticipated time. Otherwise, Nabarun Sahib, things will go smoothly, and then as we planned and as we thought it would come out. It's just a matter of time. It takes a little time to trickle these ideas in the minds of the people.
Definitely, we all hope for the same. Uh, Dr. Periwal, just when we thought just when we thought that COVID is a thing of the past, maybe, well, at least in India, uh, we sort of have a spike in numbers. Highest cases in Maharashtra and Kerala once again. These two states accounting for 74% of all the fresh cases. And there's still concern among the other states and things may spread. So, once again, are we staring at a challenging situation again?
Yeah, and we had discussed it last time also, this virus is going to stay with us and the numbers will keep coming because of the intensity of the testing that we do. So, we do not actually look at how many of them were serious cases, we just look at the gross numbers. And I tell you, one of the most comforting parts, at least in India, has been the number of serious cases has been less. So, we do not still see the health system being overwhelmed, but yeah, just like the first time over, it can happen again, maybe second time, third time and maybe every time. So, we do not need to take away the thought that nothing can happen to us, and I think that is one thing that should drive the vaccination even further, that the virus is around and we need to take protection. We have vaccine as one thing which can protect us.
Dr. Kishore Burman, do you think the Northeast Assam is ready to face a second wave? There can be fatigue among the health workers who have been rendering a great service for the last 1 year, more than that, and fatigue can sink in. Under the situation, if at all we have a second wave, how difficult, challenging the situation can be?
No, I think the second wave we can manage nicely because we have already experienced while dealing with the first phase. Fortunately for Assam, scenario was not so bad as rest of India like Mumbai or Delhi. So for the second wave, we are fully ready. Now we are experienced how to deal with the COVID, and moreover the healthcare professionals they are already vaccinated, so they can fight the second wave handsomely. I think so.
Healthcare professionals are vaccinated. That's a very important point that you have mentioned. Dr. Sham Sundar, again, that sums up. Now that the healthcare professionals, you just mentioned 63% of the target has been achieved. So now that the healthcare professionals, the frontline workers are vaccinated, probably that equips us, makes us stronger against the fight against a possible second wave, isn't it?
Right. In fact, we have already begun vaccinating these frontline workers from the 8th of this month, and though it is taking a little time to pick up the speed, it is going on now faster as the days go by, and we believe that all the target population of this 80,467 will be all vaccinated within the time frame given to us.
Absolutely.
And we cannot deny the fact that the demise of...
Yeah, go ahead.
Boliye.
Go ahead.
We cannot... there is no denying the fact that the demise of one of our health workers has had a negative impact on this process of vaccination. Many people who already were apprehensive before this happened, they have become, some of them have become more apprehensive. That is true. However, the real facts that which come to the forefront, like the number of people who have been vaccinated so far across the country and I mean globally, the number of these AFI cases are so less, and then if we attend to these cases when they do happen, there is nothing to worry about it. It is only natural that when this mass vaccination is done, some of us will have definitely some mild reactions, and we take care in time and according to the protocol that have been handed to us. There is absolutely nothing to worry about, and therefore the vaccination should continue. And this is as one of my colleagues panelist has already mentioned, this is a small price to pay, given the threat which the pandemic is posing to us. Like in fact, we never thought that the civilization may not be the same again. But now, with simple things like wearing a face mask and then distancing ourselves a little away from our fellow brothers and sisters. And then with this vaccination, I believe that we are now on the threshold of containing totally this pandemic. And in such a short time as 1 year is nothing. So some of us getting some mild reactions, some of us getting even a little more serious reactions. It's nothing. It's such a small price that we pay for coming back to the original civilization that we all were enjoying. So I believe vaccination should go on.
But do you
So
again?
all the people should come forward, and then the entire population should be covered.
Do you again think that vaccinating the masses is extremely important because as we as we are experiencing probably a second wave in Maharashtra, Kerala, maybe some other states, the same can happen in the northeast, which makes it extremely important for the masses to be vaccinated and well, probably the health departments, the state governments have to initiate a mass awareness campaign also at the same time to ensure that there is at least 70 to 80% who actually come out to take the vaccines. Probably that is required. Are steps being taken towards that end?
Yeah. In fact, the experiences which Kerala and then Maharashtra they are getting, these are sharp eye openers for the rest of the country. In fact, this confirms more the fact that we should go for complete vaccination, vaccination for the entire population of the country. In fact, the experiences which Kerala, our brothers and sisters in Kerala and then Maharashtra are getting, has taught us a sharp lesson that we must go for vaccination.
Absolutely. Dr. Periwal, what we have been seeing even in Guwahati and probably across the country, we have forgotten the COVID protocols once again. And it's important to get back to them immediately, isn't it?
Yeah, that is very, very important. Together with the vaccination program, till we are in a stage where we have total control over the disease, probably till then that's the only way we can protect ourselves. Even the vaccination is going to take time to provide you protection. I am still to get my second dose and I am expecting to be kind of immune maybe 2 to 3 weeks down the line, hopefully. And then there is such a large chunk of population still remaining to be vaccinated. So we need to take precautions now. Few months more, we have almost endured it for a year now, a few months more and then maybe we will be in the right side of things.
Absolutely. Dr. Kishore Barman, Maharashtra is contemplating another lockdown. The state government, the chief minister has said, I give you 7 days. If things don't improve, maybe we'll go for a lockdown. Lockdown is no longer an option, mind you, for most of the states in this country. We have suffered a lot. The economy has suffered. Livelihoods have suffered. Probably what we can do is that the states, before things happen, the states again need to be very strict on the COVID protocols, isn't it?
Yeah, we must follow the COVID protocol. Mask is a must. Social distancing and hand sanitization. These are the 3 basic tools for fighting the COVID. Vaccines will come later, but if we do not use these protocols, then COVID will attack us. Nowadays in Guwahati, wherever we go, we see people are not wearing masks. They are going for marriage celebration or any pujas. 90% of the people are not wearing masks. If this happens in Guwahati, definitely we'll get a second wave. To prevent the second wave, we must wear masks, social distancing and hand sanitization. Everyone should remember these 3 basic things to fight COVID. Vaccine will come later, but we can protect ourselves from COVID by adhering to the COVID protocol.
Dr. Sham Sundar, are you confident that, well, things are under control and with proper steps, the Northeast, Manipur in particular, will continue to be in control of things even if the country is to face a second wave?
Definitely. The 3 mantras like hand wash, wearing the face mask and then physical distancing plus this vaccination, these measures I am sure are enough to contain this pandemic. In fact, these measures, if we strictly adhere to them, I am sure that we will be able to wipe out this pandemic completely, not only from the state, from the country as well. And in fact, if these measures are strictly adhered to, this pandemic will simply evaporate into 10 years. In any part, in fact, globally, these are the mantras that we must stick to. And there is no, actually, there is no coming back with the idea that vaccination is creating problem, is creating reaction. No, nothing of that sort. Whatever happens with vaccination, the nation as a whole, the state as a whole must go. We must forge ahead with vaccination. We must vaccinate the entire population, in fact.
Absolutely. Dr. Periwal, last words from you very quickly. Any
Yes.
advice that you have for potential candidates for vaccine?
So get it whenever you get a chance, because you may not, it may come very late, and it's important that all of us are vaccinated at the same time. Now, we have been very lucky as healthcare workers. I think the availability has made a reluctance. If there was a queue to be made, no, we are very good at making them. So maybe we should take it that the government has taken a lot of effort to get it there across the cold chain. There were so many questions being put on logistics. We have fought them all. We got the vaccines almost at your doorstep. You know, when I got a vaccine, I get a call in the morning, or I get a message in the morning, I'm vaccinated. Oh, I get a repeat call to know how did it all go? No, how was the experience? Do you have any complaints? This is the level at which care has been taken. We need to believe that care has been taken for us, immense care, that the vaccine reaches us, and get it the day you get a chance.
Absolutely, very well put. Thank you so much, Dr. Sam Sundar, Dr. Burman, Dr. Periwal. That's a wrap of Bottom Line this evening.